So good morning, everyone. I'm James Herbert, the president of the University of New England, and I extend a warm welcome to all of our guests in the media, as well as the various dignitaries who have joined us here today. And this includes my good friend, Greg Powell, the chairman of the Harold Alfond Foundation, as well as the Honorable Kate Snyder, the mayor of Portland, the Honorable Alan Cassavant, the mayor of Biddeford, the chair of UNE's Board of Trustees, Dan Mccormick, and I'm also pleased to welcome leaders from Maine's various hospitals and healthcare systems, including Chuck Hayes, the president and CEO of Maine General, Dr. Doug Sawyer, the chief academic officer of Maine Health and of Maine Medical Center, Tim Dentry, the president and CEO of Northern Light Health, and Michelle Talka, the vice president and chief human resources officer of Central Maine Healthcare. So thank you all so much for joining us. I'm also very grateful that several others who were unable to join us in person have very thoughtfully sent recorded messages that we'll share with you today. And this includes Maine's governor, the Honorable Janet Mills, and members of Maine's Congressional Delegation. So we gather today to share some really wonderful news. It's my pleasure to announce that the Harold Alfond Foundation is making a major gift of $30 million to the University of New England to support the construction of a state-of-the-art health sciences facility here on our Portland campus. This project will enable the relocation of UNE's College of Osteopathic Medicine from the Biddeford campus to the Portland campus. It will also support the establishment of a new institute for interprofessional education and practice in which UNE's signature team-based healthcare training program will be expanded, establishing a national model that will benefit the state, the region, and indeed the whole country. This is by far the largest gift in UNE's history. In addition to transforming the Portland campus, this gift will allow us to repurpose space vacated by the medical school on our Biddeford campus. This will enable us to grow undergraduate and graduate programs in high-demand, market-aligned areas, in areas such as business, entrepreneurship, and our signature marine programs, among others. Thus, the effects of this grant will ripple across both of UNE's main campuses, having profound effects on our programs, our students, and the people of Maine. UNE is the largest provider of healthcare professionals to Maine and is home to Maine's only medical school. The university also houses Northern New England's only dental school, the state's largest undergraduate nursing program, and many important healthcare programs. These are all very impressive programs in their own right, but what makes them especially unique and exceptional is the specific training model we employ, known as interprofessional education. Traditionally, healthcare tends to be very siloed. For generations, students have been taught within strict disciplinary boundaries. Starting about 15 years ago, UNE questioned the wisdom of this approach and embarked on a mission to break down these barriers by educating students not only with deep disciplinary knowledge and skills, but also with an appreciation for working in interdisciplinary teams. Our early work in this area established us as an emerging leader in this new approach, and over time, over the past decade and a half, we've become recognized as a national leader in interprofessional education. We're now poised to invest further in this initiative with the establishment of a new institute dedicated to interprofessional education and practice in the health professions. At UNE, our medical students learn side by side with our pharmacy students. Nursing students work with those studying social work. Future dentists learn with physical therapists. And our research, supported by a growing body of scientific literature from elsewhere, now confirms the value of this holistic, integrated approach. Interprofessional education and practice leads to better patient outcomes, greater patient satisfaction, reduced medical errors, and reduced provider burnout. Now, despite our successes with this approach, we faced a challenge with the configuration of our campuses. Our Portland campus now houses almost all of our healthcare programs, except one very important one, our College of Osteopathic Medicine. By moving the medical college to Portland, we will maximize our ability to train all of our healthcare students in this interprofessional model. We will provide a state-of-the-art facility that our medical school deserves to continue its remarkable trajectory of excellence. And we will create a health sciences campus that is unprecedented in New England, housing a concentration of diverse health profession programs on a single campus that exists nowhere else in the region. The COVID-19 pandemic has laid bare many problems in our nation's healthcare system, including disparities in access to healthcare services, shortages of healthcare providers, and insufficient infrastructure in remote clinical services, among others. Through this transformational project, we intend to address these very issues. Just to offer a couple of examples, we'll build on the work of our Center of Excellence in Digital Health to build telehealth and other digital health tools into the new facility and to integrate them fully into our curriculum. And we will use these and other tools to intentionally focus on underserved populations in the region with a special focus on aging and rural populations. We can't do this work alone. We will strengthen our existing relationships with key partners, including Maine's various healthcare systems, colleagues at the Rue Institute of Northeastern University, the University of Maine system, and the University of New Hampshire, as well as Maine's many businesses and nonprofits. I'm also grateful to our strong and growing relationships with these partners and for their enthusiastic endorsement of this project. Now, as transformational as this grant will be for UNE's programs in healthcare, its impact will actually be much further reaching. Although the university has a deep footprint in the health professions, UNE is a comprehensive university, nationally recognized for programs ranging from neuroscience to marine sciences. Our curriculum stresses the intersection of career-ready skills with the development of critical habits of mind deeply rooted in the liberal arts to prepare students for lifelong learning in a rapidly changing world. This unique approach to education has helped UNE accrue many accolades, including being recently named for the third year in a row as Maine's #1 college for graduates' job placement. As I have personally learned by the opportunity to contribute to Maine's 10-year economic strategic plan last year, and by more recently serving on Governor Mills' Economic Recovery Committee, we face critical problems with workforce needs in our state. To flourish, we need more workers, especially those with college degrees in key areas. At UNE, we are laser focused on contributing to this workforce, and we are challenged by a lack of classroom and lab space on our Biddeford campus. That campus serves as the hub of our undergraduate programs, both within and outside of the healthcare fields, while also housing a growing number of non-health programs. By moving the medical college to Portland, we can repurpose the space vacated by the college to grow these programs to meet student demand and workforce needs. I envision further growth in existing programs on the Biddeford campus in the natural and social sciences, in the humanities, in business, as well as the development of new degree programs in areas such as aquaculture, criminal justice, sports media communication, and entrepreneurship, just to name a few. In short, this extraordinary gift from the Harold Alfond Foundation will jumpstart the transformation of UNE's campuses and academic programs to the benefit of our students and to the people of Maine. I'm deeply grateful to the students, faculty, professional staff, and alumni who have contributed their efforts to this project thus far, and to those who will do so now moving forward. I appreciate our dedicated Board of Trustees for its vision, wisdom, and support. I am thankful to our many stakeholders in industry, the nonprofit sector, the philanthropic community, and local, state, and federal government for their partnership. And I am profoundly grateful to the Harold Alfond Foundation, not only for this gift, but for its history of stepping in to support UNE at key moments in our remarkable evolution. I know I speak for all of my colleagues to say that much work lies ahead of us, but we are ready to roll up our sleeves and get started. So I'm now honored to introduce my good friend, Greg Powell, the chairman of the Harold Alfond Foundation, to offer some remarks. Greg?
So I'll start by saying pocket handkerchiefs aren't what they used to be. Good morning. Over his lifetime, Harold Alfond made many gifts to higher education. There were none, however, of which he was more proud than his 1995 gift to the University of New England for the Health Science Center in Biddeford. We could feel back in 1995, as we know for a fact today, that the university would grow into its name and become a great contributor to Maine, its economy, and the health of its people. And so, if Harold Alfond was with us here this morning, he would be equally proud of the plan President Herbert has just described. Let me take a few moments and say a few words as to why that is so. Since 1995, in Biddeford and here on this campus, the people of this university have dedicated themselves day in and day out to providing a high-quality, job-relevant education that deliberately and creatively prepares students to meet the healthcare and workforce needs of our state. Since 1995, UNE's growth has been extraordinary. The university has steadily increased enrollment of high-caliber students, both undergraduate and graduate. Many of these students are the first in their families to go to college. Many are from Maine, and many are from away. But most important, many of them stay in Maine, enriching our communities from Kittery to Calais with their skills and dedication to public health. Since 1995, UNE has awarded over 15,525 degrees in the health sciences. Today, the university educates more health care professionals than any institution of higher learning in Maine. Well, with success comes new needs and new opportunities. And UNE, as we've heard this morning, is not resting on its record of achievement, nor is it retreating in the face of a worldwide health crisis. Instead, it is stepping up big time. As we have heard this morning, UNE's plan will build on the outstanding success it has achieved in the past. Under the leadership of President Herbert, the UNE board, deans, faculty, and staff have shown the ability to be collaborative, responsive, innovative, and entrepreneurial in all that they do. These qualities are at the heart of the plan announced this morning. And so when the foundation was considering how to make the future of our state better and stronger, we knew UNE was just the right place to invest and that this was the time to do it. Let me leave you with this. Harold Alfond was born 4 years before the outbreak of the Spanish flu, a pandemic that took the lives of 50 million people worldwide. In 1940, as World War II erupted, he sold his car, bought an abandoned shoe factory in Norridge Walk, Maine, and launched his first shoe company. Back then, Norridge Walk was a very rural place, and it still is. And so when Harold fell seriously ill, medical help was as scarce as it was important. But Harold was a lucky man. He was lucky because there was a single family doctor in Norridge Walk, a guy by the name of Dr. Joseph Eshelman. Dr. Eshelman took care of Harold. He was an osteopathic physician, and as Harold gratefully recalled, Dr. Eshelman pulled me through. In the decade of Harold's life that followed in the 50s, as the Korean War erupted and the pandemic of 1957 took hold, Harold Alfond launched a second shoe company called Dexter Shoe. He married, started a family, and created the first private foundation in the state of Maine. The foundation to which he left his fortune and which has stood behind the mission and growth of UNE for the past 25 years. As we reflect on this history, we see that times of great challenge and anxiety are also times of promise, hope, and opportunity. And from that history, we see a great and promising future for Maine and its people. And we see UNE as a huge part of that future. What could be better? An innovative, collaborative, entrepreneurial university with terrific leadership. A university dedicated to producing healthcare professionals, more of them, and all working in teams. And in doing so in a time of great need, promise, and opportunity. You can't get much better than that. So on behalf of the Harold Alfond Foundation, our thanks to this university for all it does and will do in the days ahead. Congratulations and good luck.
Thank you. Thank you so much, Greg. I appreciate that. And now I'd like to introduce the Chair of the UNE Board of Trustees, Dan McCormick.
Thank you, James, and thank you, Greg, and the Harold Alfond Foundation. On behalf of the Board of Trustees of UNE, I'm pleased to join you all today and offer the board's enthusiastic support for this project. UNE has grown from its modest roots to become Maine's largest private university, with 2 vibrant campuses in Maine and 1 in Tangier, Morocco. As President Herbert noted, UNE is home to Maine's only medical school, Northern New England's only dental school, and is the state's largest supplier of health professionals. UNE's health professions programs are of the highest quality. For example, our nursing students routinely have the highest board pass rates in the state, and our medical students are ranked in the top 10 nationally of all medical schools for students being placed in their top choice residency program. It's pretty impressive. You've heard today about many benefits of UNE's interprofessional education training model and how this project will develop the tools to further develop this model. As a local healthcare executive, I thought it would be helpful to share firsthand experience from the benefits of this model. So I work in a primary care setting, and in a previous role, we worked with a member of UNE's pharmacy faculty. Dr. Rachel Meyer helped us develop a program to assist patients in adjusting their opioid prescriptions in accordance with the new state law passed a few years ago. Dr. Meyer became an integral part of the care team, and she had students with her while she worked with our primary care physicians and collaboratively developed plans for each patient. Dr. Meyer also had expertise in diabetes care. She was part of our diabetes care team. And I think having a pharmacist on staff in a primary care setting demonstrates the versatility that we can have when we have interprofessional education and we have healthcare practitioners who can work together and collaboratively with our patients in mind. I'm also equally proud of UNE's non-healthcare programs. For example, among the fastest growing programs we have at the university are those in the marine areas. UNE's marine science program was recently ranked number 7 in the nation. Pretty good for a little university in Maine. Not so little anymore. I think the impact of UNE's research has likewise grown. And so when we think about where we are as a university, we can consider that UNE just last year was elevated by the Carnegie classification from a master's university to a high research activity doctoral university. We now are the only other university in Maine, along with the University of Maine campus in Orono, to have that designation. And we were the only university in New England to achieve that elevation in rank. So I think that speaks to all that is going on our campuses. I think it's also important to note that UNE students do exceptionally well after graduation. One index of this is reflected in the fact that UNE's alumni have among the lowest student loan default rates in the nation, far below those that both the averages at the state and the national level. I think it's what underlies this is that these accomplishments represent that we are a nimble, adaptable culture that appreciates history but is not bound by it. UNE has a culture that encourages innovation, a culture that faces challenges head-on, and a leadership team that looks boldly toward the future and is not afraid to take calculated risks, as we're announcing today. The plan for programming on both of UNE's main campuses described today will position the university for the next chapter in its remarkable evolution in ways that will benefit the entire state. And so with that, on behalf of the university's trustees, I extend my heartfelt thanks to the Harold Alfond Foundation for this transformative gift. I look forward to working with President Herbert and his leadership team as we realize this vision. Thank you.
Thank you so much, Dan. I really appreciate the kind words. And so now we have remarks from a very special guest who's not actually with us in person, Governor Janet Mills.
Hi, this is Governor Janet Mills. I'm pleased and honored today to join President Herbert, Maine's Congressional Delegation, Mayor Snyder, Mayor Cassavant, Greg Powell, and representatives of Maine's hospitals in celebration of a landmark investment by the Harold Alfond Foundation in the University of New England. You know, when I ran for governor 2 years ago, I met so many Maine people across our state who lacked access to affordable health care. Too many people who couldn't see a doctor, who couldn't afford prescription drugs, who couldn't get preventative care they needed to stay healthy and contribute to our economy. So in my first year in office, we made great strides. We expanded Medicaid, we enacted prescription drug reform, and we rebuilt our public health infrastructure, just in time, I might add. All that progress is important, but the COVID-19 pandemic has thrown into great relief the challenges that still exist in our healthcare system. Maine's doctors, especially those who serve our rural areas, are nearing retirement, and that further limits access to high-quality care for Maine families. I'm grateful to the University of New England for their efforts to address that challenge by training the next generation of doctors and other healthcare providers in our state. Today's investment by the Harold Alfond Foundation will allow UNE to consolidate all healthcare training programs in Portland and provide a new high-tech training facility to house Maine's only medical school, and to accelerate the development of programs aimed at addressing other key workforce needs in our state. So I congratulate UNE on getting this award. It's a well-deserved gift. And I thank the Harold Alfond Foundation for its continuing investments to strengthen our state. Partnerships like these build a brighter future for all of Maine. Congratulations, and thank you, all of you, on behalf of the people of Maine.
Thank you so much to Governor Mills for sending those remarks. I'd now like to invite to the podium the Honorable Kate Snyder, the Mayor of Portland.
Thank you, President Herbert, and thank you all for having me here today. This is just so exciting. It's also just exciting to be out of my house. So I am pleased to be with all of you here today to help celebrate this extraordinary gift and extraordinary movement forward. So many thanks to the Harold Alfond Foundation for your continued deep and impactful generosity in the state of Maine. It's really a lucky thing for the state of Maine, so I wanted to take a minute there. Portland is so proud to be one of UNE's homes. As you all know, this began as Westbrook College in 1831, and under whose charter UNE still operates, I've come to understand. And from those early days, UNE has grown into a powerhouse, attracting students from all over the country to its many programs and world-class research. By moving the medical school to Portland, this campus will not only become a hub of professional health training and research, but will join Portland's growing and expanding biomedical research group. Earlier this year, I was pleased to be part of those who welcomed the Roux Institute to the city of Portland. This is all just so exciting for our city and for our region and for our state. And I understand from my conversations that President Herbert has been already partnering with the Rue Institute on joint research programs and joint academic programs that will move to accelerate all of these programs together, which just creates such a powerful synergy. This is just another step in strengthening Portland's position as a biotech innovation hub. We appreciate this. I very much look forward to working with you in whatever capacity I can and however the city can help. And I just want to say thank you again to the foundation and congratulations to UNE.
Thank you so much, Kate. I really appreciate those kind remarks. And now I'd like to introduce my friend, the other local mayor, the Honorable Alan Cassavant, the mayor of Biddeford, Maine.
Best part about speaking today is I could take this mask off. You know, my mother used to say, when you have a special ceremony or event, I hope it doesn't rain on the parade, but on a day like today, I hope it rains because, you know, the weather has been just way, way too dry. Well, I want to thank President Herbert and the Alfond Foundation for this generous donation. I'm so happy to be here to join my colleagues in celebrating this extraordinary announcement, this investment. You know, UNE was born on the Saco River back in 1978 with the merger of St. Francis College and the New England College of Osteopathic Medicine. I'm a Biddeford kid. I remember St. Francis College very, very well. When I was in my teens, I used to break into the gym, which I think is now the Leonard Building, to play basketball on a regular basis because Jim Bodra used to leave the key in a certain place and we knew where that key was, so he'd let us in. And when I became a teacher at Biddeford High School, I was always amazed at how many teachers there were St. Francis graduates. So even though it was a small school, it had a special place in the Biddeford community. When the union formed in '78 and the University of New England became the new name, some of us kind of snickered in a way because University of New England, that sounded so big and maybe a little bit too big. But you know what happened? The presidents back then began to work towards making sure that that university actually embodied that name. And so today what we have is a first-class world organization based on those original dreams and also because of what's been happening today under President Herbert. Importantly, the university has maintained the core Franciscan qualities of education, such as things like service to others and environmental stewardship. And I think that's important in today's world because academics, granted, important, but being part of a community, being able to be responsible to others is similarly very, very important. The plans that we're announcing today actually brings UNE to the next level. And it benefits the communities of Portland and Biddeford because of the investments that take place, but also because of the partnerships that have formed. Again, going back, when I was a teacher at Biddeford High, professors came into my classroom on a regular basis. Students were there on a regular basis. They're cleaning parks. They're helping out in whatever way they can. If we have a problem in Biddeford, I go to James or someone else and say, can you help us? And the answer is always, sure we can. Let's see what we can do about it. That is why it's so important that we support this investment. We support these new programs. You know, Biddeford is State of Maine's youngest city. It continues to grow. It's home to so much new innovation, and UNE's been part of that innovation on a regular basis. The experimentation and the programming continues. And by expanding the programs in the key areas and working with our businesses, I see further development and further growth into what we call the Biddessance in Biddeford, the renaissance of the communities on the Saco River. You know, I considered President Herbert to be a friend of mine. We talk fairly regularly, we email, we have the same taste in food. In other words, we like everything. The difference is somehow he stays very slim and I mentioned food, I gained 5 pounds. I don't understand how that happens. But I know with his skill and his talents and his staff that they will do everything they can and will be successful in capitalizing on these dreams. And I can assure you, President Herbert, and to the board of directors and everyone else, that I and the staff at Biddeford City Hall will do what we can to partner in moving this whole plan forward, because I just think it's a tremendous opportunity for the students, the staff, the faculty, and of course the communities themselves. Thank you very much.
You know, I have to say, at UNE, we are so incredibly fortunate to be housed in the communities where we are, and you can see that just in the remarks of our respective mayors. And so, Mayor Cassavant, Mayor Snyder, thank you both so much for your visionary leadership and for your partnership with UNE. I just can't thank you enough, and thank you for being here. So now we'd like to offer remarks from Maine's Congressional Delegation. We have remarks from Senator Collins, from Senator King, and from Representative Pingree.
I want to sincerely congratulate President James Herbert and all my friends at UNE for the incredible news of the Alfond grant to move toward the vision of establishing the comprehensive medical campus in Portland. Having dentistry, pharmacy, and then the wonderful medical school there from UNE will be an incredibly powerful medical engine for the state of Maine. It will be generating and producing doctors, pharmacists, dentists that are so important in our state, and putting them all together on the Westbrook campus in Portland, I think will be a great force multiplier, if you will, for those three schools. So congratulations on the vision, and congratulations on the grant that will help to implement the vision. Good for UNE, good for the Portland area community, and good for the state of Maine. Thanks to UNE and to the Alfond Foundation. A great move for all of us.
It's a pleasure to congratulate the University of New England on the launch of this exciting initiative. The new institute will enhance the university's leadership role in training of healthcare professionals here in Maine and throughout New England. My thanks to the Harold Alfond Foundation for the generous support we celebrate today. This $30 million gift is the largest in UNE's history. It recognizes the leading role the university plays in healthcare education and delivery in Maine. The commitment that Harold, his family, and the foundation have made to healthcare, education, and youth development throughout our state enriches so many lives and creates opportunity. As home to Maine's only medical and dental schools, a physician assistance program, and a pharmacy school, UNE plays a vital role in our state's future. It helps to keep our best students right here in Maine. It also attracts high-achieving students from elsewhere to come to Maine to study and to stay. There's an old saying in medical education circles that doctors will practice within 100 miles of where they train. UNE graduates have proved that saying true, and thankfully have extended that 100-mile radius to other rural parts of Maine. As the senator representing the oldest state in the nation by median age, and as chairman of the Senate Aging Committee, I'm so grateful for UNE's leadership in programs supporting Maine's seniors. As an example is the Center for Excellence in Aging and Health. By enhancing collaboration among all of the university's healthcare programs, the Institute will advance the center's work. From the College of Dental Medicine to Alzheimer's disease research, I've worked closely with UNE. Whenever I advocate for federal funding for a program at this school, I do so fully confident that the American people will see a beneficial return on that investment. UNE is dedicated to science, the humanities, personal and professional ethics, and service to others. On that foundation stands an institution of national renown and an innovative spirit. The commitment to making a quality education available to students of all backgrounds benefits us all. Thank you for your commitment and best wishes. I look forward to continuing to work with you.
Hi, I'm Congresswoman Shelley Pingree. We've weathered some tough times in recent months. The coronavirus pandemic has upended our lives and threatened our livelihoods. For so many of us, job security, access to affordable, reliable health care, and the ability to put food on the table are now precarious. But I think this pandemic has also demonstrated our state's resilience. We always find creative and collaborative ways to get through the tough times. Mainers know we have to work together to address these challenges. We've been reminded of what is so wonderful about being Mainers. As Greg Powell recently said, Maine has a great future. Newcomers have been empowered to move here because they want to live a meaningful life, surrounded by the beauty and community we're well known for. We are so lucky to have the Alfond Foundation making generous gifts across Maine, investing in our state because it truly does have a great future. These transformative investments will help to expand and strengthen our higher education system, bolster our workforce, and help build stronger communities. I'm thrilled that these investments include a grant to the University of New England. UNE already does so much to keep Maine healthy. With this generous grant, UNE will be able to affirm and expand its statewide commitment to quality, affordable, accessible healthcare services, something I care deeply about. UNE is committed to educating its students on the value of team-based collaborative care, and I'm proud of its national leadership in this space. Relocating the College of Osteopathic Medicine will build on those efforts by uniting these students with other health professional programs. The Institute for Interprofessional Education and Practice will further secure UNE's reputation as an innovator and prepare the next generation of healthcare professionals to make a difference across our state. Especially coming out of this pandemic, UNE's expertise, from interprofessional education to telehealth to addressing the needs of rural Mainers, will all help Mainers access the care they deserve. I'm proud that UNE and the Alfond Foundation are stepping up to be a part of the solution, whether through visionary investments or transformative education. Congratulations on this impressive grant, and thank you for all you do. Take care.
I'm very grateful to our congressional delegation for those kind remarks and for their support. One of the things I love about being in Maine is because we're a small state and we're really one big family and everybody is separated by everybody else from maybe 1 or 2 degrees, that's all. I can actually pick up the phone and talk to our senators and our congresspersons, which is just remarkable. And it really allows us to work much more closely with not only the folks in state government, but at the federal level as well. So I'd now like to introduce one of our oldest partners, the president and CEO of Maine General, Chuck Hayes. And Chuck, I didn't mean oldest partners as in you being old. I meant our partnership with Maine General.
I'm very honored to be speaking here today. This is truly an incredible gift from the Harold Alfond Foundation. Medicine today is too complex for one individual or one discipline to have all the answers. It requires a full team of medical professionals to fully care for an individual. The shared curriculum among health professionals that the University of New England has created allows students to understand the expertise of other members of the healthcare team, and, as importantly, how to effectively work together as a team for the benefit of the patients and their families. Now, with this funding, they have the ability to integrate more health professionals in the learning and the teamwork to raise the bar for quality and outcomes even higher. We're fortunate for 25 years, Maine General and UNE have collaborated to help educate future healthcare professionals. Maine General has benefited tremendously from the great doctors that have graduated from this program. More than 15% of our medical staff are graduates of UNE. Today, the country is currently faced with medical professionals retiring at a staggering rate. Timely access to care is one of the largest determinants of health. The expansion of the medical school and having additional physicians who are placed in the workforce is so critical to the future of Maine's healthcare system. We are very fortunate to have a high-quality medical school like UNE in the state of Maine. And we are so grateful for the support of the Harold Alfond Foundation in addressing the most critical needs for the future of healthcare in this state. Thank you.
Thank you so much, Chuck. I really appreciate it. And now I'd like to introduce another one of our key partners. This is Doug Sawyer, the Chief Academic Officer of Maine Health and Maine Medical Center. Doug?
Thanks, President Herbert, for inviting us to come comment on this great event. I have to say, I was sitting and listening to the remarks and reflecting on how this is not in my prepared statement, but you'll like it. I've been collaborating with UNE since I finished my fellowship training when I wrote a grant in collaboration with a faculty member at UNE. The sad thing was I realized I wish I could have gone to medical school there, but at the age I am, UNE was not developing doctors at that point. So then I had my first research technician in the lab, I'm a physician scientist, went off to UNE, and I got to see the great training that's provided for doctors at UNE. And I'll come back to that story in a second. So Maine Health, as we all know, I hope, has a three-part mission focused on improving the lives of our patients' health and wellness. And it does that, we hope to do that through providing outstanding care that's affordable, educating the next generation of healthcare workers, and researching new ways to provide care. And those last two parts we do in collaboration with partners like UNE. We're fortunate to have a partnership that's been around for a while, and I think this geography change is going to enhance our partnership. We are a key partner for UNE in that we provide clinical opportunities for the trainees as they go about getting their clinical rotations. And likewise, UNE is a key partner for our mission as we help develop these doctors and nurses, PAs, and pharmacists, and others that become part of the Maine Health workforce. I was looking at the numbers that somebody sent me. I didn't have time to fact check it, but I'm told that 11% of our healthcare staff across Maine Health are graduates of UNE. And so I was reflecting on that. I couldn't do the whole fact check. That's 1 in 9, by the way. That's a lot. That's more than any other graduate program in the country or world. So an important part of our workforce. And I was reflecting, I don't have the data, but I have the qualitative data to say that's probably true. I think about a collaborator of ours, Teresa May, who's a critical care physician, graduated from UNE, doing outstanding research trying to improve the provision of care for cardiac arrest survivors across our state. I think about Tom Miller, who trained in pediatrics after graduating from UNE at Maine Medical Center, went off to become a pediatric cardiologist in Utah, and we were able to recruit him back to lead the cardiology division for pediatric cardiology recently. And the wonderful fact about Tom is he was that research assistant I mentioned earlier. And he is just an outstanding physician who's making sure that we can provide for congenital heart patients in a way that they don't have to travel to Boston, which is a hardship for many of our residents. I think about Patty Johnson, who is a graduate of the UNE PA program, and Patty and I round together when we see patients on the heart failure service. And I reflect, as I was listening to y'all, reflected on how well these three people are trained in interprofessional education and are able to provide interdisciplinary care, whether it's Teresa in the ICU, where you have a really highly interdependent team that's necessary to take good care of patients, particularly in the last 6 to 8 months in the COVID era. Or you have Tom Miller, congenital heart physician, who really works with a team of nurses, nurse practitioners in their office to provide the best care. And I think about Patty as a PA working on our cardiology service. And I am overjoyed to see what we're doing here with UNE, moving the DO program into Portland and fixing the geography of getting the doctors that are being trained together with those other professionals. So I also think about the geographic impact on us. I think it's going to be tremendous to have the DO program in Portland and learning how we can help enhance our rotations for the clinical trainees in that program is a good opportunity for us. I should mention that the research programs are also growingly intertwined between UNE and our own research institute, with faculty at UNE collaborating and mentoring young faculty in our research institute, new grant programs being awarded, and as well as new ones on the horizon. The Northern New England Clinical and Translational Research supported grant from the NIH, for example, this year in the pilot program awarded 2 pilots to faculty at UNE doing important work for improving health of the rural members of our community. So I'm very excited about the change in geography. We're really looking forward to working with you and helping the next generation of providers be the best interprofessional care. Thank you.
Thank you, Doug. Really appreciate your remarks. And next, I'd like to introduce Tim Dentry. Tim is the President and CEO of Northern Light Healthcare.
Good morning. Thank you, President Herbert. You know, this gift from the Alfond Foundation will have such a positive impact throughout the state of Maine. Absolutely. And, you know, during COVID times, I don't think this is stating the obvious, but leadership really matters. And this is such an expression of leadership. It's fabulous to be part of. Post-COVID, especially now more than ever, we need adaptability and creativity. You know, we're all talking about what's the post-COVID world going to be like and what's going to be different. And we can't just fall back on everything we did in the past. So we need learning and research and education and an expression of youth in so many ways, and that is the learning institution that this entails. And I'll give you an example of that. This is really great. You know, we have through Northern Light and through the College of Osteopathic Medicine here at UNE, we have, it's the largest campus with 42 medical students doing clinical rotations. So in the month of April, you'll recall that was when everything pretty much shut down, if you will. A lot of practices and services and surgeries and things of that nature. That's tough for health systems when that's what we do, you know. But the third-year residents and medical students and others that were in the training situation across the system that were part of UNE, they manned the phones. So telehealth really started up then. So it's not only the phones, but the iPads, if you will. And so our system went from 1,000 telehealth visits per month, much of that was in our behavioral health hospital, Acadia, to 38,000 in the month of April. And most of those telehealth visits were done by our medical students. And I had a Zoom call with a big bunch of them. And it was kind of great, you know, a lot of them were from home, and so dogs are running around and little kids are running around and that kind of thing. But they were just really proud that they could step up and help throughout the state of Maine during this crisis. And so that's the kind of spirit that this is connected with. We have embedded with the College of Osteopathic Medicine third-year residents in our rural and primary care practices. You know, Northern Light goes from, you know, Prescott to Portland, as I say, and they're really part of the local healthcare team and really develop those relationships with the members of the community. UNE provides more doctors to EMMC than any other medical school. That's been expressed by some of my colleagues here as well. But also nursing is such a critical kind of a thing. Very personal to me as well. My mom was a nurse. One of my first mentors was Sister Mary Thomas. She was a pediatric nurse, president of Mercy Hospital in Baltimore, Maryland. So now Mercy Hospital here in Portland is near and dear to my heart. My wife is a nurse. Nursing students, and the fact that we have 23% of the graduating class of last year are working throughout Northern Lights. We're very, very proud of that, and doing a lot with PAs, etc. So we're very proud of the relationship that we have, very thankful for this, and really look forward to enhanced creativity in the future. Thank you.
Thank you so much, Tim. Really appreciate those remarks. And last but not least, we have Michelle Talka, the Vice President and Chief Human Resources Officer for Central Maine Healthcare. Michelle?
Good morning. Thank you, President Herbert. I'm so pleased to be here today. As the Chief Human Resources Officer for Central Maine Healthcare, my primary and ongoing concern is the development of the next generation of healthcare providers. As my healthcare colleagues can attest, there's a critical shortage across the state in every type of clinical care program, and it's only predicted to get worse. So this gift couldn't come at a better time. We've been a partner with UNE for many years. We are dedicated to educating and training new providers. We are a clinical campus for their third-year medical students, who ultimately end up many times joining our family medicine residency, or at least coming back to practice in the Lewiston-Auburn area. In fact, more of our physicians come from UNE than any other single medical school, as many people have attested here today. We also further the education of many of the other clinical programs here at UNE. We host rotations for CRNAs, physician assistants, the pharmacy school, and likely others. And we provide hands-on clinical education and training for them. UNE graduates very well-prepared providers. We found them to be educated throughout their career to serve not only urban populations, but underserved populations in the rural areas. And they've been trained to treat those underserved populations throughout their education. The investment from the Alfond Foundation, as I said, couldn't come at a better time. It will expand access to quality health care for our Mainers across the state, continuing both the foundation, the university, and Central Maine Healthcare's legacies of improving the well-being in the state of Maine. Thank you.
So thank you so much to everyone, and I really appreciate everyone coming out today to support this announcement, this remarkable announcement. I'm so grateful, Greg, to the Harold Alfond Foundation for this gift, that it really will be transformational, not only for UNE, but for our region, our state, and beyond. So thank you all so much for coming, and please feel free, if you have a few moments, to stick around so that we can get some photos. And everyone have a great day. This auspicious rain that we finally have, that's much needed, it's a good sign for the future. So thank you all so much for coming out today.